Hi, good morning, everybody. This is Andrew Lalo, Shu President. It was so good to see all of you. Wow, today is going to be a good webinar. You know why? Because a lot of people don't realize what is fatty liver disease and how that they link to cancer. Now, a lot of my client who has diabetes, they also have high cholesterol. Many of them actually have fatty liver disease, which they don't even know until they actually went to the doctor and check it out. Now, if they didn't take good care of that, eventually that is going to be bad for them. That is the reason why, because fatty liver disease, if you continue to don't take care of it, it will start eventually get a lot of fat and create scar to the liver. Now, this scar to the liver is going to be eventually get the liver malfunction. And sad part is as time goes on, this scar might develop in such a way that you're going to end up with cancer because of the scar. They continue to, get decreased liver function, and eventually this scar might change to actually cancer. So really, you really cannot ignore this. You got to work on it to make sure that you are in good shape to continue to changing lifestyle, help you to make sure that you are not falling to poor liver. And so today we'll dive deep to help you to understand why the liver is so important. Because liver cancer is very deadly, actually. So you don't want to be in that boat. Okay. So shall we start? Okay, good. Okay, great. Wonderful. Okay, now we start. Okay, today's topic is fatty liver disease and cancer risk. And this is something that I think will be a great webinar for you to better understand what that is and what can we do daily living just to change that. Now, if you change that, you can be very healthy and will not fall into that liver cancer disease. So that is so important. So today we'll talk about what is fatty liver disease and what are the common symptom and the risk factor go with that, and how the liver health affect you not getting cancer, and that's so important. So how you can able to improve the liver health and not getting your cancer and decrease your cancer risk. And that is very simple. Actually, just a simple daily diet, exercise, and so forth will definitely help you naturally. And how Lo Shudi can actually help you all on all this. So today, that's the topic. Now on here, you can see there's a QR code which you can actually take a picture, and you can actually go back in the future to see all our lectures. It's free. It's worth 440 lectures in there to continue to help you to better understand what is, all the things about cholesterol, blood pressure, blood sugar, how it affects you. So anyway, today, this is the webinar, and I think this is something that really you can, and educate yourself to better understand why the liver is so important. Now, so everyone today comes over. I have a lot of new guests, which I don't know their names, as I'm familiar, so they probably newly joined us. So I always catch up with them with four stages of diabetic, because a lot of people don't know how diabetic comes. The first stage, LDL cholesterol goes up, damage the B cell coming out from the pancreas. B cells will take it back to the blood sugar to the cells, but it doesn't take care because damage. Then you have more sugar circulating in the vessels. So LDL cholesterol and the sugar add together, your problem can start because the blood becomes thick and start forming plaque throughout the wall of all the vessel, entire body. And very quickly you move to stage two, because what happened is the space of the vessels getting less and less and less. So blood pressure will start going up. When blood pressure goes up, you know what? You will probably no feeling, no pain, but as time goes on, you're doing the same lifestyle, everything unchanged. The blood pressure will continue goes up, and very quickly you move down to stage three, which is the pre-diabetic stage. The pre-diabetic stage, everybody and all the doctor will do the same thing, measure this thing called HbA1c, because everyone has a hemoglobin cells, this blood cells, and they'll measure the percentage of sugar attached to this hemoglobin. If you're 5.7 and Below, you're a normal person, 5.7, 6.4. Now you're pre-diabetic. Unfortunately, pre-diabetic, you have no drugs to help you out. Doctors say you're not diabetic now. What you got to do is just change your lifestyle. If you change your lifestyle, then you can be actually better and never go to diabetes. But you don't do that very quick, 2 to 3 years, you will change to diabetes. So change your lifestyle, actually eat low carb diet, low fat diet, exercise, lower your weight, and so forth. But there's one thing can help you, and that is low sugar tea. Low sugar tea definitely help you to lower your blood sugar, cholesterol, and blood pressure. Now, if you don't do any of this, 2 to 3 years, guess what? You will change to diabetic because the A1C will, once it moves to 6.4 and above, you are diabetes. And most likely the doctor will give you medication. Once you're on that thing, you ever is diabetic in your record. And that result, your insurance goes up, everything goes up, and you basically continue not to take care of yourself. You have all kind of problems that come along way. Now, why we want to talk about low sugar is important that you can able to really get yourself a lot more take care of it before you move yourself down the road to, more serious diabetic. Okay, so now, oops, sorry. So we talk a lot about low sugar tea. Okay, low sugar tea. Why we talk about low sugar tea? Well, low sugar, two things in there. That's one, the guava leaves that take uh, decrease, rather slow absorption of sugar into the blood vessels. So less sugar go to the blood vessel. And then they have second thing called bitter melon. Bitter melon is also a vegetable that actually able to increase insulin sensitivity, take the sugar to the cells. The wonderful thing is the excess sugar, excess LDL cholesterol, and salt will be dumped out through urine. So result, all three high, which is the sugar, cholesterol, and blood pressure will come down, plus to give you able to help you detox. So this is a very natural product. It's not a drug. It's just two food, guava leaves and bitter melon, and it works as long as you keep drinking the tea, and it's going to help you. Now, certainly we don't want you just drink the tea because you really have to learn how to change your lifestyle, meaning that you have to do your daily diet with low carb diet. Hopefully you can do 150-gram low carb diet. You can calculate every time everything you eat, you know what is the gram of carb you take. Also, low fat diet, you have to exercise 8 to 10,000 steps a day. Not necessarily just walking. You can do a step master. You can go to any place to get a step master, cost you maybe $50 US, and Hong Kong is on $150 or $300 around there. And it's basic. All you do there is step masters, just go up and down, and then you can move your body in the lower extremity. And then you can use a barbell, just do this part, go up and down this way, move, and then you can expand your lung, and you can basically your shoulders, everything will go loosen up. How you do that? If you do it for 30 minutes, I can assure you, you lose 300 calories and also lose many of the, burn out a lot of sugar. So you have to also control your weight. You got to BMI has to be around 23. If you're 30, you have to take exercise, diet to control, get your BMI down to 23. Plus, you can listen to our Dr. Vamp, nurse professional webinar every week. This is free for you. You can just listen. It's very simple. And you can do blood tracking, food tracking, weight tracking, exercise tracking, and we have all that for you. It's free. Now, where many people actually had A1C more than 10, they dropped down to 5.7. Again, this is the webinar QR code you can look at, so that way you can able to see all the previous lecture to help you to better understand your understand the knowledge of why high blood sugar is bad for you, how you resolve that, and lower your blood cholesterol and also your blood pressure. Okay, that's that. So why liver health is so important for you. Now, really, at the end of the day, a lot of people just ignore liver because, well, why I need to do that? Okay. Because liver is one of the body's most important organs. It performs hundreds of functions, methods, at least 500 functions every day to keep your body healthy. It helps you to remove toxins from the bloodstream and process nutrition from food, store vitamin energy, and regulate your blood sugar and cholesterol level, produce bile to digest. So when the liver become unhealthy, many other body systems may also affect, like poor liver health may increase the risk of heart disease, diabetes, inflammation, and other long-term health problems. So liver for sure is one of the most important organ for you. You got to take care of your liver, my friend. So very important. So what does it matter why fatty liver disease is going to be an issue? Now, fatty liver disease happens really too much fat start collecting inside your liver cells. Okay, so especially there's a medical term, it's called MASLD, which stands for metabolic dysfunction associated cystotic liver disease. Now, forget about very technical term, but AMASLD. Okay, so when people really have liver disease, it's usually they thought that, well, maybe the guy drink a lot. Well, it's not really true because not all there's a lot of non-alcohol drinkers also have big fatty liver disease problem. And so really, if they don't touch alcohol, they can still get that. Well, how does that happen? So especially liver disease are delivered very slowly. And maybe especially people will be like overweight. If I'm BMI really 330 and above, or 35 or whatever, the chance that you get fatty liver disease is high. Also, I'm a diabetic. That's also high. High cholesterol. Also, a poor diet. I don't exercise at all. I always stay here, watch TV, or do my work at work. I don't walk at all. So usually, this is the people who have fatty liver disease. Now, in early stage, usually for this liver disease, you can reverse it by healthy lifestyle, exercise, change food diet, and all that good stuff. But if you do not take care of that, over time, this become a more serious disease. And that is important because this is the time when you have fatty liver disease in the early stage, you can actually change just because of diet, exercise can help you to improve. Okay. So keep that in mind to understand that. The sad part of this is when you have liver disease, you don't know it because usually you don't see it and don't feel it. Okay. So so with that, there are two things. One is the early stage MASLD, which is fat buildup in the liver. Now, if you don't do anything to it, more and more, eventually you're going to get MASH, which is a more serious disease because your liver is start getting inflamed, and meaning swell up, and your liver is start getting damaged. Now, when you get ongoing damage, a certain over time, fat builds up, inflammation develop, and then the sad part is this damage is start forming scar, and this scar will basically damage your liver, and your liver function is start declining. Wow, that's scary. So net result, if you get really bad decline, you're gonna get what they call a cirrhosis of the liver, which is mean a very severe scar of the liver. And if you have continued to high cirrhosis liver, that will risk of actually move you to liver failure and also liver cancer. Imagine that. You don't want to be in that boat. You want to be not getting cirrhosis of liver. You want to make sure that you don't want to get your inflammation bad enough to go in cirrhosis of liver. So this is why early prevention is so important. You got to understand that, hey, am I actually getting a lot of inflammation? If liver function is not really bad, it's really getting worse and worse and worse. Not only sky, eventually go to cirrhosis, you want to take care of that. You want to stop right away. Don't get it get worse. That is the objective what you got to do, okay? So you don't want to get into MASH. And if you go in MASLD, you need to start working on it to improve your liver function and not make it worse. Now, but the sad part is usually several common health conditions that you are actually putting yourself in a fatty liver disease risk. So you got to understand what that thing will, what kind of body condition will increase your fatty liver disease. Now, one of that very simple, excess body weight and diabetes, high cholesterol, high blood pressure, and among the biggest, these are the biggest contributor to your liver issues. So if you are any of this, I'm overweight, I'm diabetic, well, you better start looking at how can I basically change this or get it better, healing, control high blood pressure, cholesterol, control type 2 diabetes. That is something you need to start doing. Now, on top of that, poor dieting. Like, for example, I'm a very high sugar food eater. I love bubble tea. I like dessert. Also, I eat a lot of hot dog because I like processed meat, processed meal, very unhealthy fat stuff. Now, with that, you can also increase the build of fat build up in your liver. And so this is again another one that you can really get you the risk factor increase your liver disease. Now, another one, a lot of Hong Kong people have that problem. The lack of physical activity. They don't exercise. They just sit around. That result, they have slow metabolism, and that result, they all worsen the overall liver health. So many adults develop fatty liver disease is because the metabolic syndrome is really affected, not really exercise. They don't do anything. They sit down. They just keep doing the office work, especially people in Hong Kong. They don't usually do a lot of exercise. Net result of that, they actually become they accumulate a lot of fatty liver, plus affect the heart health, and also because they don't move much, the blood sugars also goes up. So all that is just tied back into the same thing. You have excess body weight, obesity, type 2 diabetes, high blood pressure, high cholesterol, all that come back in. So net result, you really got to look at that. Do you have that risk? So you need to ask yourself, am I have overweight, type 2 diabetes, high blood pressure, high blood cholesterol, and my diet is terrible and I don't move, no exercise. So these are the poor factors. Definitely is I don't do much activities at all. If you have that, you need to start thinking about are you possible with a liver disease candidate? Now, unfortunately, typical liver disease usually do not exhibit much sign. Okay, so in the early stage, you usually have no symptom. Okay, but as time goes on, the condition will get bad, and usually start up with like constant fatigue, low energy, discomfort in upper right abdominal area, swelling in the leg, and also abdomen, plus yellow of the skin and the eye. Now, all these are the early symptom of the liver disease. However, the symptom usually come out very slowly, not you come out very acute, because liver the damage usually already ongoing, but the symptom don't show up quite easily. So many of the regular people at age 40, they found out that high liver disease or liver fat is when they see the doctor, a health check at age 40, they say, wow, I have fatty liver disease. Okay, now that is really caught a lot of people in surprise. So, but if you really have any of this, like for example, I get constant tired, I am, low energy, I have discomfort over here. Like my leg is start swelling and my abdomen is also swell a bit. You gotta go to see doctor right away because you gotta get doctor help for this. Okay, you cannot do it by yourself. You gotta get a doctor to help you. So why? So the next question you might ask, well, if that's the case, why there's no symptom? Usually, why fatty liver disease is called silent disease? Why there's no symptom? Well, the reason is because many people usually thought that, well, I'm ongoing. and while your liver is continued damage over time, but you have no idea what's happening, so you don't take any kind of precautions. So usually many of the early stage, since there are no symptoms, so many people discover the liver disease are usually by accident. Like for example, when the doctor offers, they take a blood test, and then suddenly say, "Wow, okay, I've starting my liver disease." Discover this through just routine blood tests, and also sometimes they take a ultrasound scan, especially with an obvious reason, obvious symptom rather. And then they start realizing, wow, you are actually having the scan showing that, wow, you're really having inflammation and the scar of the liver's already there. So all these through the medical checkup, you become actually realizing, wow, I now get liver disease. Now, if you don't go to the check, most likely you don't even find out. That's why age 40, you really got to go to the doctor to give you the physical check. And that is so important because this is the time that you can able to recognize, do I have a liver disease? Secondly, do I have diabetes? Three, do I have high cholesterol? And four, especially I'm overweight, I'm obese. All that will shows up in your doctor check, and it's so important. You need to continue to basically get the doctor to monitor, do you have a fatty liver disease, or you have all the other disease that come along with it, like high blood sugar in pre-diabetic or diabetes, high cholesterol, and also high blood pressure. All that will be something that you need to take care and together at the same time. Okay, so now the doctor say, hey, you have fatty liver disease. So how the disease progress, in a sense, how it continue to develop, is so important to understand that. You know why? Because liver disease has very little symptom in the early stage. So usually fatty liver disease tend to develop gradually by years. Usually become just simple fat build up and there's no symptom, and this fat build up in the liver cells just continue to build up, but you don't feel anything. Now, if this inflammation continue to develop, with your fatty liver disease, the cells start building a lot of fat build up, the liver start getting inflamed. So now the liver became an issue because they will start, this inflammation is going to start forming the scar and start forming in the liver. Now that continued inflammation eventually, the liver is not healed and become fibrotic. And on top of that, it becomes cirrhosis of the liver or eventually the liver fail. So first of all, the fat goes up and then you don't take care of it. It becomes forming scar, and the scar will continue to develop and become fibrotic. And net result, you will get cirrhosis of the liver or failure. So detection early is so important. And hopefully, because you make it early, I have liver disease. Okay, I know that now I need to change my lifestyle and continue to reverse that damage. Do not allow the liver continue to form so much scar, because more scar you become lead to fibrotic or fibrosis, and you don't want them to go to the cirrhosis of the liver. So net result, you need to continue to screen, monitor, understand where you're at, and hopefully, with all the things you do, changing lifestyle, you can actually, reverse the fatty liver disease, not getting to be serious, become a MASH, whereby you can start getting cirrhosis and liver failure. You don't want to do that. Okay, so you want to continue to do that. Now, how do you link between liver disease and cancer then? Because a lot of people say, wow, your liver disease, you can have cancer. Now, imagine if your liver are continue to be very fatty and what it gonna cause chronic inflammation. Net result of that, you got to start damaging your liver cell because your liver are continue to be scar along and damage liver cells. So the body pretty soon is they can't repair the liver anymore. Now, don't forget, when you early stage, if it's a little scar here and there, the body will repair your liver. So your liver can go back to healthy. It's not they just scar and stop. They will actually, if it's a small amount of scar, they can continue to repair and make your liver become healthy again. But people don't do that, continue to do the same thing, continue to damage liver. So the people start forming MASH, which is called where you start getting MASH, then you start get fibrosis of the liver. You know, the liver becomes scar so bad that it becomes big scar. So you have cirrhosis of the liver, which meaning many part of the liver start dying, and you become with that the chances to get liver disease cancer is going to be very high at that time. So you don't want to get cirrhosis of the liver because when you get that, you have higher chances to develop of liver cancer. So, but on the other hand, if you're able to decrease the chronic inflammation, then healthy with especially a healthy diet and able to have the doctor kind of monitor your progression, your liver. So if you're able to reverse this inflammation, the net result, you can actually have a better chance to not to get cancer. So importantly is don't want to get chronic inflammation, continue damage the liver cell in such a way that the liver cannot regenerate itself, and that net result, that's the time you have a major issue in hand. Now, besides liver, how does it link up to other disease? Because if your liver is bad, will it link up to other disease? The answer is yes. If you have a lot of high liver, fatty liver disease, actually is not only affect your liver, but is also connected other serious health conditions such as heart disease, such as stroke, such as diabetes, and all that complication. Now, especially if your body continue to have chronic inflammation throughout the body. So really, at the end of the day, it's not only a liver. If you have poor liver and you have, fatty liver disease problem, if you have MASH, that is definitely will affect your other part of the body and whole body, like blood sugar, diabetes. Sugar is very difficult to balance, and you have all kind of diabetic complication, and the whole body will be involved, and including your health and overall wellness, and especially including your heart. That is the most important, because in all these, if your heart is going to be in weak and bad, now you're going to have more issue in your hand. So you don't want to get yourself because of liver and get you to all the different health issues that will come along. So think about that. That is really sometimes you really think about, I got to take care my liver. Hopefully with that, I can control with better health and not get into diabetes, blood sugar, blood pressure, and so forth, right? Okay. So now, really at the end of the day, you want to check your liver, you have to go to a doctor, because you know why? He has to take a blood test to detect that you have elevated liver enzyme. If you elevated liver enzyme, that's mean your liver is inflamed or in stress. So that is important. You have to check your liver enzyme. Now, if also if the doctor say, hey, there might be a liver enzyme going up, so they might usually take an ultrasound image and so see how much scar you have, and really looking at, is your liver build up a lot of scarring of the liver, and in some case they need to do additional tests, and so with that, that is all come from the doctors who are taking care of you and reviewing many of the medical history, and make sure understand where your liver damage. So it's not only blood tests, it will be ultrasound to see how severe your liver damage, and with that they will continue to check and understand where you're at. So they don't want to continue to get you worse. They want to get you control, make sure that your liver hopefully will get regenerate and do something that you can get better. But meantime, there's something you can do, definitely. Now, remember, you have to have healthy eating habit for your liver. So most important, you have to actually eat more vegetable, more fruit, whole grain, and fiber-rich food that can help you reduce the fat buildup and inflammation in the liver. So really, at the end of the day, if you can do that, your fat in the liver is going to go down. Plus, you have to limit your sugar drink, processed snack, like fried food, like French fry, McDonald's. Now, all excess unhealthy fat can also will increase your cholesterol and blood sugar level. So you eliminate that, you have lower cholesterol, better blood sugar level. Now you're gonna healthy, much healthy. So you will be continue eating this healthy eating, and not really just a small step. And you can do that, then you can actually help to improve your liver and lower your liver fat. From there, don't have to wait for all the things you have to do. Just start up with healthy eating first. Small habit, okay? Now, the second thing you have to do is you have to exercise and manage your weight. Remember, obese and no exercise can actually improve your, decrease your, improve getting all more fat into the liver, so decrease your liver health. Okay, so regular physical exercise is one of the most effective natural way to support your liver health. So you have to do exercise every day. Now you can do step master with a barbell doing this way. Okay, walk, all that is actually will reduce your liver fat, improve your circulation, support your blood sugar control, lower inflammation. All these things, even just walking, stretching, like what I did is Stepmaster, really all that is actually consistently not only lower your blood sugar, cholesterol, but important, lower your weight, because that will help you do better weight management. Now, net result, you progressively continue lower your liver, fatty liver, fat in your liver, and improve overall energy. Now, if you consistently do that, that's the most important. Not only do it one day, not only do it 1 week, you have to continue doing that. Now, if you continue to do that, you know what? Your benefit is tremendous. You will definitely will get yourself much more healthier. Now, also, a lot of people don't realize you gotta reduce your alcohol and added sugar drink. Alcohol is actually worsening your liver damage. Excess sugar will actually get your liver fat increase. So you really have to basically everything you do start reading the nutritious label. Wow, what a carb. Oh, it's 20. Oh, it's 70 carb. No, I don't want to take that. I want to take 7, 8 carbs item. So all those things you have to read the nutrition label, understand you choose healthy beverages, not really all those sugary drink, and cut down the alcohol for sure. For sure. That will help you a long, long way. Now, so you gotta basically very simple daily lifestyle tips. You change a little bit. You talk about better diet, a lot of fiber, a lot of food, exercise. Now, what you gonna do? Cook home cooked meal, not to go out to McDonald's a lot. You have to drink a lot of water. That's why low sugar tea actually get you to drink 2 liters water. That's the reason. Dilute your blood and able to excrete all the poison from throughout your body, and you have to move regularly, exercise, and then you got a doctor checkup all the time to make sure your liver is good, liver function. Focus on regular health, focus your health, and gradual continue change. Don't go for perfect, but do it daily. You will do that. Okay. Now, certainly in Hong Kong, there's drink that you can go for pro liver tea, but if not, just drink low sugar tea. That will be good for you. Okay, so basically, Otruti is something that is a herbal drink that we make in Hong Kong, which maintain a better overall metabolic balance, might promote steadier mood, better energy, and day well-being. So this is available in Hong Kong for many of our Hong Kong customers. Now, why low sugar is important? Because low sugar, actually, the two things in that there's actually guavity, bitter both guavity delay sugar into the cells, bitter increase insulin sensitivity, pick the sugar back to the cell, excess sugar, cholesterol, and and salt will dump out through urine. So that result, 3 high will come down. Blood sugar, cholesterol, and blood pressure, all that will come down. And certainly that is easy to drink with thousands of people in Hong Kong using, and US actually, using Lo Shu Tea. They see tremendous benefit overall for prevent them from pre-diabetic to diabetes, so they don't become diabetic anymore. Or if they're diabetic, they bring them back down to pre-diabetic state. Many of them are achieving that, and they also continue to drink it. Okay, so in conclusion, fatty diseases are very common, especially if you're age 40. And many people might not notice the symptom, especially it's a really silent disease, so to speak. So if you're age 40, you gotta go to the doctor office to do a blood test check, see how good is your liver. Now, if you don't do anything, your liver will continue liver continue to develop. What it does is the liver become chronic inflammation and start scarring your tissue, the liver tissue, and eventually it become bad, it become fibrotic, and then eventually cirrhosis of the liver, and eventually you may get so serious that also liver cancer will develop, plus your liver is going to not work anymore. Wow, you don't want that. So, and some of the risk factors are, you're obese, you're diabetic, high cholesterol, poor diet, I eat a lot of junks, chips, I eat hot dog all the time. So all that can contribute your liver damage over time. So you gotta really start changing that to get healthy eating, regular exercise, weight managing, make sure you don't get obese, and help you to support that liver health naturally. And more important is early awareness. In other words, go to the doctor, always take a blood test or ultrasound, understand where you're at, and you want to have starting prevention with a good diet, exercise, weight control, and you want to continue to develop this healthy habit, and then that result, you will improve long-term wellness. Also, drink Lo Shu Tea or Pro Liver Tea will definitely help you with better liver function. Take care, my friend. This is today's webinar. I hope you can end up understanding a little bit better, how to take care of yourself. More important is to get early detection with very good dieting, regular exercise, weight management, and lower your blood sugar. All that will help you to overall better health and support your healthy liver naturally. Take care. And if you have any question, write to us. I'm Andy, ANDY, at wahfong.com, ANDY at WAHFONG.com, or WhatsApp us, 852-6792-8891. You can able to send us message. We'll always answer you. So you have any question, do write to us. Well, a lot of people write to us all the time. And I appreciate you spending the time with us and able to better understand your health. And that will be actually wonderful. And I think you can able to continue to do that. You'll be able to get healthy. And that result, you live longer and enjoy your life and enjoy grandchildren. That is our